Hello and good morning to all my dental assistants, office managers, and LDAs. Did you know that there is 5 things that we could say there are 5 musts that need to be added to a prescription in order for us to be able to save time, but most of all a headache? If you are interested, please don't forget to subscribe and ring the bell for the new video notification. Stay tuned. Once again, my name is Christy D, and I will be sharing you the 5 musts that need to be on a patient's prescription in order for you to be able to save time, but most of all, a headache. Having to call a patient twice or 3 times for a case that you're sending to the lab could be very frustrating for the patient and yourself. And these are just 5 basic things that need to be said on the lab script in order for the lab to be able to do their part. Alright, listen up. They're very simple and very basic. I'm going to go ahead and write them down and I will share them with you as we go. So, the very first one, as we all know, definitely, always please, go ahead and add a patient's name. As funny and ironic as it may sound, I worked in a dental lab for over 7 years and I've had many cases that have to be entered without a patient's name. It doesn't save time for the lab. It's very hard. Sometimes we are placed in hold when we make a phone call to the office, and then I have to be transferred to the manager, and then the manager has to stop what they're doing and ask when the prescription was written, and sometimes whoever wrote up the prescriptions is not even dated at the bottom. So it's just very hard and it's not time saving, okay? So definitely always make sure to put a patient's name on your prescription. Very important. First and last name. The second thing that we always get is we don't have an office name, the practice name. Some of these offices that we receive belong to part of a group, and for example, it's called Smiley Forever, and I'm just making this up, Smiley Forever, and they put the name on the prescription, Smiley Forever, but yet since they are a group, they have several offices in different areas of the state. And it just makes it hard for us to even know if it's a Fort Worth, a Dallas, a Houston area location. So we have to be calling and bothering your other sister offices in order for them to kind of guide us where this doctor practice is at, and where, just to kind of find. Sometimes we're provided with chart numbers, and that's very helpful too. So my second one on this list is always, if you are part of a group especially, put the name of the city, the street that you're on, anything will be helpful. So definitely the second one is going to be office name. Excuse me. There we go. So the second one is office name. The third one that we notice that it's not on the prescription. Okay, so we got the name, we got the practice name, but then we don't get, for example, if it's a removable case or even a crown case, we're asked to do a PFM, or in the removable department, we're asked to do a partial. PFM and partial are universal. It's kind of like ordering pizza, and forgive me, but we go to a pizza place and we say, hey, I'd like to buy a pizza. It's not just buying a pizza, it's what kind of pizza, what type of crust, what topping would you like on it. So we need to get a little bit more information. So if we say, please fabricate a removable partial and finish, we'd like to know what type of partial. As you know, there is several types of partials, and that will be on my next video. I will describe each and every appliance in the removable department, and I will describe also each and every Crown and Bridge product as what they look and the difference and what they are, resistible and so forth. But I don't want to get into that detail right now. We're talking about the 5 musts. So we'd like to know what we are making. If you put PFM for a crown case number 30, that to us could be a porcelain non-precious, it could be a high noble, a semi-precious. So we'd like to know more. Please always be more descriptive on your lab script. We like to know what kind of pizza, what topping you like. So I'm going to put on here, describe your product. So we'd like for you to describe more what you're requesting. And that be for both departments or any lab request that we need, okay? And the fourth tip, or the must, I'm sorry, that we need to add on a prescription, or we must have in order for us to know, is a due date. A lot of the times we get cases where the patients are scheduled on the day of the delivery. I always strongly suggest, please don't do that. It causes a chaos at the delivery date, because we are not on the same page. And this is where the confusion pretty much starts. It's when we are asked to deliver, for example, I need my case by Friday the 22nd, and you have your patient schedule on the 22nd at 1 o'clock, let's say, because that's the time, and it's counting correctly on the due date. But the only thing is that we have a courier service. Most of the time, any dental lab has a courier service that picks up the night before and delivers the next day. For inexpensive reasons, we ship with the ground service, just because we guarantee your case to be there on the day of your due date. But we don't guarantee the time. We know it could be there between 3 and 5 o'clock, but we cannot promise it would be there before 3 o'clock. So that is the main reason why we always suggest to not schedule the day of the delivery. In case, even if the courier fails to deliver your case on time, at least we have some time to work and make it happen the next day, the day of the appointment. Now this is rare, but it happens, and let's be honest, life is not perfect, and any courier could drop the ball. So we ask you to please never schedule your patients on the day of delivery. That is actually my number 4 tip. I jumped to it, sorry. So the first one, but the one before that, is provide us with a due date. Excuse me, I'm going to abbreviate due date because it doesn't fit there. And the fourth one was, the fifth one, which is never schedule your patients on the day of delivery. Okay, and right now I feel like I want to add tip number 6 on there, just because I noticed it is important for us to have a patient's name on the lab script. Always provide us with that. The office name, the location, if you are part of a group, it's always very important. It saves time. Sometimes we don't deliver cases to the offices because we have no clue where it came from, and we just have to let it sit after we finished it and wait for someone to call angry, where's my case? And that prevents all of that. So please always provide us with a location. Of course, doctor's name goes on that, but describe your product. Like I said, we're going back to the pizza thing, and it might get old, but this will be used a lot. And trust me, I love pizza too. But it's always describe what you want. Don't just put partial. The word partial denture or partial is universal. We need to know you need a flexible partial, you need the metal frame partial, the acrylic partial. So please help us with that. And the other one is provide us with a due date. Do not schedule your patients on the day of the delivery. And the number 6, I'm going to go ahead and add one on there, is always provide us with a tooth shade. Don't ever forget the tooth shade. It is very important. We can't guess patients' color teeth. So please provide us with a tooth shade. And if we're doing a removable case, don't forget to add a gum shade. Okay? We always need those. And that was tip number 6 to add on for a bonus for you. Please don't take this personal. This video is supposed to be helpful. It helps both ends, our lab end as well as your dentistry end. We want to make your experience with the dental lab, with any dental lab, to be as smooth as possible. And we will talk a little bit more on my next video of the type of products and materials, the difference of them. So that's going to be an interesting video. I truly invite you to look out for. If you'd like, please go ahead and subscribe to get a notification of my next video when it comes up. Ring the bell, please. And again, I appreciate your time today. I hope you have a wonderful and excellent day at work today. Have an awesome one. Christy.